Jonathan Gibson. It's my pleasure to present Jonathan to you all. Jonathan is the campaign leader for Metabolic Support UK. He holds a BSc Honours degree in biology and an MSc in global health and infectious disease. Prior to his time at the Metabolic Support UK, he worked at the NHS Biomedical Science Laboratory for 4 years and has worked for Metabolic Support UK for over 3 years. Jonathan is a prolific worker and as communications coordinator at Metabolic Support, he covers a wide scope of activities. With his talk, Think Ammonia, the insight from communities at risk for hyperammonemia and next steps to improve outcomes, Jonathan will cover the results of his hyperammonemia survey and will give an insight into the Think Ammonia campaign. Jonathan, we are all ears.
Thank you very much. It's a pleasure to be here. So thank you very much for having me and to listen to this presentation. So as Persephone's already mentioned, I am the campaigns lead for Metabolic Support UK. If you don't know who we are a patients organisation based in the UK, and we support people affected by inherited metabolic disorders. So as part of this, we have launched the Think Ammonia campaign. So how it started, the Think Ammonia campaign was inspired by our communities after we received reports over the years of people experiencing severe neurological effects and death as a result of hyperammonemia. This has a risk for many of our communities, including those living with urea cycle disorders. And then this was once again reiterated when we received contact from Pushpa Gatania, mother to Rohan Gatania, who's pictured here, who died aged 16 as a result of hyperammonemia. And it was interesting listening to the presentations from the previous speakers because this is quite similar in a case because this young man was 16 and he had a protein shake. He lived previously undiagnosed with any kind of symptoms of urea cycle disorder, but then after consuming this protein shake began to feel increasingly unwell, had decreased consciousness and things like that, to the point where his mother decided that it would be a good idea to take him to hospital. During the hospital, he went to a district general hospital. They were recommended by a specialist centre to do an ammonia test at that hospital, but that actually wasn't carried out. 2 days later, unfortunately, Rohan actually passed away. He was deteriorating rapidly. They were treating him for things like sepsis and meningitis and things like that because of these similar symptoms. But yeah, he passed away. And the family decided to do something positive with this. They thought, right, this is a really negative thing, but we'd like to donate his organs onto someone else. So then 6 months later, the recipient of his liver actually experiencing very, very similar symptoms to Rohan. Was admitted to hospital and a biopsy was done of that liver. And then it was realised that Rohan had actually died as a result of hyperammonemia. And then that was brought on by an undiagnosed urea cycle disorder. So I think that really drives home the importance of hyperammonemia. And from obviously hearing reports from our community and from the report from Pushpa as well, getting in touch with us, we thought it'd be a great idea to launch this campaign to improve outcomes. So the setup, aiming to ensure this campaign is a success, we held a hyperammonemia roundtable and brought together a working group of experts, including senior doctors and lab staff, to guide this campaign. The experts range from people from the BIMDG, who you've heard about today, so the British Inherited Metabolic Disorders Disease Group, and they actually guided us to develop a lot of the resources and to ensure that everything is scientifically accurate and can be used in those district general hospitals with this lack of awareness. We then worked to develop that branding, the web pages, posters, and other materials to help ensure the campaign aims achieved for our communities. So I'm just going to give you an insight into a survey that we did just to gain some insights, because we didn't want to just hear stories. We wanted to be data-driven and see where those issues were. So 34 people responded. This ranged from people living with conditions to obviously parents and carers due to the limited mental capacity of some of the people affected. 8 IMDs were actually represented. And a big thing there is that 92% reported inadequate staff awareness. Obviously, this is associated primarily with rare conditions, so there's a lack of awareness around that. And then that led to 62% reporting testing challenges, and then 48% reporting a lack of awareness about timely testing and treatment. So that then led on to 33% waiting 3 to 5 hours for appropriate treatments. Obviously, there's that lack of awareness. We've seen issues in which lab tests can be sent down. There's no urgency around them. So basically, that's then delayed that whole process. And then due to the neurotoxic effects of ammonia, that then leads to negative outcomes. So 65% reported long-term negative outcomes due to delayed recognition, and 92% of those were neurological. So if that was included in that initial testing, the ammonia test, that could have been avoided, or at least sort of ameliorated a little bit, so that people could have better outcomes. So this just sort of sums it up. So this was a quote received. So this wasn't just a quantitative survey. We also got some qualitative data. So this person said, "My daughter was born in 2012, and very sadly, nothing has changed in all this time. Newborns, children, and adults are dying or have disabilities due to raised ammonia not being recognised, and this needs to change." And I think that's so powerful. And this is the sort of stories that drives us to pursue this campaign and to ensure that it's successful for our community, so that when they are going to these A&E departments or healthcare settings, they have the ability to be tested and to improve those outcomes. So the aims of the campaign. So we want to raise awareness amongst the public and healthcare professionals to increase the number of ammonia tests undertaken and decrease lab sample rejection, because that's quite a big issue. And I can touch on that a little bit more further on in this presentation. But yeah. So the actions, so send them posters to healthcare settings with information on how to diagnose, test and treat hyperammonemia. So these posters we have developed both for healthcare professionals and for the public. And this has got guidelines. So through speaking to Dr. James Davidson, who's based at Gosh, he sort of talked us through what the important things to include on. So test in case of encephalopathy. We've got different symptoms on there for people to understand that. It gives them guidance on how fast to get that down to the lab. So within 30 minutes from a free-flowing venous blood sample, and then it's got how to treat it. So then that links through to the BIMDG emergency guidelines. We've also got other guidelines available on our website, including guidelines from the RCPCH, that's the Royal College of Paediatrics and Child Health, and the Royal College of Emergency Medicine. And so they're available on our website. We'd also present at events, of course, we're here, but we also present at other events, so continuous professional developments for healthcare professionals. So we had one last year. I'll go into that a bit more detail, but that was really well attended and was brilliant to come along to share some details. And we were accompanied by a clinician and someone from a lab as well, so they give people the context. Then we raise awareness, obviously, via public with social media and at events. And then we've created that pages with guidance for public and healthcare professionals that's accessible within our Hyperammonaemia hub. And then we are translating our materials, obviously, for use across other countries outside of the UK. So there's been translations for Peru, Sri Lanka. We've got ones for Afghanistan, and those resources are being shared within those countries as well. So that's really good, because we thought if we develop these resources, they might as well be adapted for other countries so that other people can have that benefits. Because what we've heard is that although there are many issues within the UK, it can be magnified even worse in different countries where there maybe is a lack of testing capability, lack of availability of drugs and things like that. So I'm just going to give you a little bit of insight into the reach of the campaign so far. So this is just year one of the campaign, and we are looking to upscale this even more this year. But so far, we've reached 41,258 people on social media. 100,000 people have been reached with community videos, as these videos are videos from our community. I've got a short excerpt from one later on in this presentation, but basically just talking about their experience of hyperammonemia, what they've gone through, what their sort of recommendations would be to healthcare professionals. So they're available on our website too. And then we got 1,153 people have accessed our webpage, 22 events have featured Think Ammonia, 23 today. And 400 posters have been sent across the UK. And these posters have been translated and shared in 4 countries. And we do have more posters as well. They'll be getting shared out further. So the events, here are 3 events we took the Think Ammonia campaign to in order to raise awareness and to generate support for the campaign. So the CPD events for healthcare professionals, I've mentioned that already, but that had 333 attendees. And this was healthcare professionals ranging from clinicians to lab professionals. And after this, we asked people what their take-home message was. And I think this really stands out for us. So obviously people have said, think ammonia and unwell patients not responding to medical management, call for help early and start treatments immediately. They've highlighted, because in this we highlighted as well, that many people said they thought it was just an issue that could affect pediatrics, but it was highlighted that it could obviously affect adults too. So they said presentation can occur at any age, and fast identification and treatment are vital to improve outcomes. And obviously, with regards to the testing capability as well, so samples are being received into labs and stuff like that, and were not being tested immediately. They were being hemolyzed. They were degrading, obviously, because they were left for a long time. So people have said it's important to analyze samples immediately on receipt into the lab. Then we were presented at the University of Cambridge for student healthcare professionals, because if you don't know about these conditions and the symptoms of these conditions, how can you be expected to accommodate for it? How can you be expected to test for it? So we presented at the University of Cambridge for student healthcare professionals. This had 60 attendees. We shared details of the campaign and stories with future healthcare professionals. Last week as well, we also went to the University of Oxford as well. Did a poster presentation for attendees there, and that was very well attended. So that had 100 attendees there, and that was another really good opportunity to educate those healthcare professionals. And then we had a urea cycle disorder day last year. So that was a really nice event, brought together different members of the urea cycle disorder community. We shared resources with them, and obviously these posters that could be displayed in the healthcare settings, they are then using those to go to their healthcare settings to basically say, this is my condition, this is what needs to be done about it. They can be displayed in any departments, and basically that just gives people that peace of mind. Okay, I've got a resource there. They can access it. They can access the guidance nice and easy. And then they feel cared for better, and it increases that awareness and visibility amongst healthcare professionals, particularly in the district general hospitals where there's a lack of awareness. So our work does not stop there. We've got some next steps. So data collection. This campaign is about more than just raising awareness. I think a lot of the times people can say, okay, we're raising awareness about something, but how can we actually measure that impact? So we want to make real change to improve outcomes for hyperammonaemia. We have sent out FOI requests to hospitals across the UK to obtain data on ammonia testing and sample rejection. So if you don't know what FOI requests are, they are freedom of information requests. Each hospital has a freedom of information team, and they are mandated to basically provide that data if available. So we sent out 69 FOI requests. They were sent to sites across the UK. We've now received 42 responses back, and we're getting some really interesting data. So there's one site that had a 55% rejection rate for ammonia tests, and that really highlights the issues that can occur due to delayed sending down to the lab, or delays in actually testing and things like that, and the sample degrading. So with this, what we will do is work directly with those sites, and we were advised to contact these sites via working with our healthcare professional team, or by engaging with our communities about where they've had issues and things like that. And with this, we're going to take directed action to work with those sites specifically to raise awareness, and that's going to be in collaboration with healthcare professionals from across the UK. We've got consultants on side, so we've got consultants in inherited metabolic disorders that are willing to work with us to address these issues. And we will work with them to send out different things like posters and different materials as well, to ensure they've got the materials available. International collaboration. Obviously, I've talked about this a little bit before, but our posters have been translated into 4 languages that are being shared across Peru, Afghanistan, Pakistan, and the USA. As you can see there, We've got a poster translated for Peru. These are now being shared across different events within the country, and these have been adapted as well for their specific environment. So this has been worked on by healthcare professionals from Peru and are now being shared, which is great. We're also working on international collaborations for webinars across Latin America and Europe. So it's brilliant to work together. It'd be amazing to develop a page for Greece, and I'd be happy to work with Greek healthcare professionals on this to ensure that we've got that guidance available. This is a brilliant first step, the webinar, to educate people. But if we take this further, I'd be happy to work with yourselves to build different pages for Greece, to publish Greek guidance and things like that, and to work with yourselves to translate those resources for distribution. So I'm just going to give you, I think it's really powerful, the power of the patient voice. So here, this is Lucas. He was born and he has Hyperammonaemia. This was undiagnosed, but this is just a short clip from his mother, Charlotte, because when he was born, he started deteriorating really fastly. And it was really important to speak to the communities to hear their insights. I'm just going to give you a short video from Charlotte.
I do think that once he was in NICU, if the ammonia test had been done earlier, it might not have got as high as it was. Because obviously by the time he went to the Evelina, we'd been, I think it was about 24 hours after we'd gone, by the time he started the hemofiltration, it was 24 hours after we'd been in NICU. And I think if we'd gone into NICU, done the initial tests and done the ammonia test as part of that initial testing, his ammonia would have still been high, but it wouldn't have been quite as high, and it might not have had such a long-term impact on him. Because Lucas now is, he's non-verbal, he's partially tube-fed, he can walk independently, but he is physically delayed as well. He's 5 now, nearly 6, and he can't walk downstairs, and he can't walk upstairs, and he can't jump or run or, you know, climb and those kind of things. He can walk. He's got quite low tone though, so he gets tired really quickly, and we do have to use a wheelchair with him as well. Like I say, he's non-verbal. He has an intellectual disability as well, and he goes to a special school. He's recently been diagnosed with autism as well. Like I say, he's tube fed. He can eat, but because of a lot of his sensory needs, he doesn't eat very much. And he's been tube fed since he came out of hospital, basically. So although I don't necessarily think that earlier testing would have prevented all of that, I do think it would have helped a lot with some of those things. So if children are presenting as an unknown, I do think that ammonia should be thought of as one of the things that they need to check. If you know you've got your initial list of tests that you need to do, your infection markers, all those kind of things. If those are all clear, the next line, ammonia should be on that list, the next kind of line of investigations. Although it is rare, it's not impossible. And my son is proof of that.
I think that really sums it up. So powerful to hear from the families about their experiences that they've had. Obviously, the outcome for Lucas, although he's got some mental sort of symptoms that have occurred as a result of that initial diagnosis not being made quick enough, that could have been a lot worse. But by recognising that ammonia needed to be tested, and by eventually testing it and then achieving those treatments, he's actually able to live now, and he's clearly living well with his condition despite it. Obviously, for other members of our community, the outcome wasn't so good. So I think the take-home message there is to think ammonia, and then think ammonia Greece. So obviously, I'd love to work with yourselves to translate our resources for distribution across the country. We've got webinars, so this is brilliant. It's absolutely brilliant to work with you here to raise awareness and to work with such a brilliant and esteemed panel. Thank you so much for Persephone and Krikos for organising this. It's absolutely brilliant. And then if there are any other ways that you'd like to collaborate with us, we would happily work with you. because we are truly committed to ensuring outcomes are improved, not just in the UK, but obviously internationally as well. If there are any questions, I'd be happy to answer them. And if you think of anything after this or would like to get in touch, my email address is jonathan@metabolicsupportuk.org. Thank you very much.
Then, what can I say? Your presentation says it all. And I really congratulate you and Metabolic Support UK for this wonderful initiative and the truly inspirational achievement so far. The slide with your reach out was particularly impressive, spreading the word to 4 far-off countries, Peru, Afghanistan, Pakistan, USA. We've made a start here with our ammonia-focused webinar, which, as far as I am aware, is the first of its kind in Greece. I certainly hope we will be able to move forward and achieve the aims of improving access to ammonia testing and awareness of hyperammonemia in frontline healthcare settings, because there is a lack there. It's not so easy from our side over here, but where there's a will, there's a way, and we will certainly collaborate with you. Are there any questions? I don't see anything in the chat. Spiro, if you would like to add something.
I just wanted to say that from Jonathan's presentation, what is really nice in that campaign is the participation of the community, of patients and parents as well. And I think that this is a great initiative, and it is always important to involve the people who have experiences, because as health professionals, we always have stories, heartbreaking stories to say, of patients that, you know, they have been handicapped or even died after presenting with hyperammonemia. But I think that the involvement of families and patients is what it makes this campaign truly important. And thank you very much, Jonathan, for that.
Thank you very much. Yeah, it's a pleasure to be here, and it's a pleasure to work with yourselves and to have that collaboration between the patient communities as well as the clinicians. It's been so powerful, and I think together we can really drive change. So thank you so much for today. It's been a pleasure, and obviously looking forward to working with you in the future.
Excellent.
We thank you too, Jonathan, and keep up the good work. Although I don't have to say that, we must start working over here, I think. Okay.
Thank you.